work to create a world
that's free of infectious diseases.
We work to make sure
that no infectious disease
is left unchallenged.
We discover, develop,
implement and evaluate
health solutions,
working alongside the most at-risk communities.
Doing so ultimately builds
a healthier, safer world for everyone.
We are the Kirby Institute.
So thanks everyone for joining us today for the Kirby Institute seminar today. My name is Ben Bavington. I'm based with the HIV Epidemiology and Prevention program here at the Kirby Institute. So of course, I'd like to begin by acknowledging the traditional owners of the lands that we meet on today. So here at UNSW, that's the Bidjigal people of the Eora Nation. And we'd like to pay our respects to elders past and present. And we'd like to extend that respect to any Aboriginal and Torres Strait Islander people here in the meeting room and also online. So just some housekeeping to start off with. So how this will work today is we just have the one speaker, Sarah. She will speak for a period of time, and then we'll have a Q&A session at the end of that. So if you're joining us online today, you can ask questions throughout the entire seminar just by typing into the Q&A box at the bottom of Zoom, or if it's Zoom or Teams, whichever one, Zoom. And you don't have to wait till the end of the presentation to start putting your questions into that Q&A box. And for our live audience today, you can raise your hand or during the Q&A session, or actually what's actually better than that is just walking over to that microphone and lining up behind that if there's a whole ton of you and speaking directly into that microphone. It's important that you speak into the microphone so that everybody online can hear what is being said. Thank you. So it's my great pleasure to introduce Associate Professor Sarah Calabrese today. Sarah is an Associate Professor at George Washington University, JWU, in Washington, DC. So she's also currently a Fulbright Scholar visiting fellow here at UNSW, and that's she's based down at the Center for Social Research in Health at the moment. She earned a PhD in psychology from GWU and completed a postdoctoral fellowship at Yale. And her research focuses on stigma and sexual health. And it is my great pleasure to introduce Sarah. We're collaborating at the moment on a project that she's working on, doing some interviews here with clinicians and also over in the US. So it's very exciting to have you, Sarah. Welcome.
Thank you, Ben, and thank you to the Kirby Institute for inviting me to be here today. I too would like to acknowledge the Bidjigal people as the original custodians of the land. So the game plan for today. Most of what I want to talk about today is a mixed method study that I did back in the US with Black sexual minority men, and it focused on targeted PrEP social marketing. But in addition to that, I also want to share some emergent insights from the project that Ben mentioned. So that is with both providers as well as MSM living with HIV. And then at the end, I'll wrap up with just some thoughts around targeted social marketing. So first, just in the way of background, some of you may be familiar with Disparities in the US, others may not. Sorry, so it's easy for people to read. Thank you. So in the US, PrEP uptake is disproportionately low among Black people and other key groups. So if you look at the pie charts here, you see that Black or African-American people make up 13% of the US population, but account for 43% of new HIV infections. And although they account for 43% of new HIV infections, they make up only 11% of PrEP users. And if we drill down a little bit further and look at Black men who have sex with men, or Black sexual minority men, Here you can see HIV disparities both for the US in general, as well as for Washington, DC, which is where the study I'll be discussing was based. So you can see that Black MSM account for over a quarter of the new HIV diagnoses in the US, and they also account for over a third of new diagnoses in Washington, DC. So shifting to social marketing. In PrEP social marketing campaigns to date, particularly in the US, efforts to enhance access and uptake have often involved targeting key groups in visual advertisements, and often Black MSM are among those key groups. However, Stigma presents a unique challenge for PrEP social marketing. So if you think about it, PrEP, the product, is stigmatized. PrEP is associated with HIV, which is stigmatized. And then many of the key populations disproportionately affected by HIV, i.e. the target audience, are themselves stigmatized. And so in the US, Black sexual minority men face stereotypes that are specifically related to hypersexuality, sexual risk, and disease. So in this mixed methods pilot study that we did with Black sexual minority men in the US, we wanted to systematically evaluate how targeting that group in PrEP visual advertisements impacted judgments of advertisements among that group. So in other words, like, how are these advertisements landing with the group? And to determine whether differences in PrEP social marketing campaigns, so looking at different campaigns that have targeted this group, whether that impacted judgments of ads or moderated the effect of targeting. And then we also just wanted to look at PrEP visual advertising preferences among Black MSM more generally. So this was an exploratory concurrent mixed methods design. We had equal emphasis on the quantitative aspect as well as the qualitative. The quantitative included a longitudinal survey experiment with 2 time points spaced 8 weeks apart. And that included a sample of 96 individuals. And then there were 4 focus groups with 18. Participants were recruited in Washington, DC, as well as other East Coast cities. We primarily relied on dating apps, in particular Hornet, social media, and then also referral by other participants. You can see the eligibility criteria there. So for the survey, participants needed to identify as a Black or African-American man. They needed to report their HIV status to be negative or an unknown, to be sexually active with men, to have never used PrEP, to be able to read and understand English, live in the US, and be 18 years or older. And the focus group eligibility criteria were similar, except that the groups were restricted to cisgender men, and they were not restricted by PrEP experience. So no matter whether you'd had PrEP experience or not, you were welcome to participate in the focus groups. So the online survey experiment, at time 1, after participants reported background characteristics, so sociodemographics, et cetera, they were randomly assigned to view 1 of 12 different visual advertisements. And this was a full factorial design where advertisements systematically varied by campaign as well as targeting or couple composition. In other words, who's in the image. And I'll show you the images in just one sec, but I've listed there the 3 campaigns that we drew from. And we sought permission in advance to use these images from the campaigns. And then the couple compositions, you can see there were 4 different compositions. There was a Black MSM couple, a Black heterosexual couple, multiple diverse couples that included a Black MSM couple, or no couples. And no couples was essentially a control condition. So participants made 16 judgments about the advertisement to which they were randomly assigned. And then they completed measures of PrEP stigma and PrEP motivation, as well as completing an attention or manipulation check item. In other words, an item to ensure that they had paid attention to the image they were asked to view. So here is the 3x4 grid. So you can see along the left, the campaigns are labeled. So each row represents a different campaign. And then across the top, you can see the different couple compositions labeled. So each column represents a different couple composition. So these original ads were, so this is the adapted version of the original ads. So they're largely the same as they were originally, except that we changed some superficial differences. So one of them was essentially black and white. So we made all of them black and white so that that color didn't impact perceptions of the ads. And some of the ads had the word condoms in them, some did not. So we made it so that all of them had condoms in them, so that wouldn't impact judgment. So at time 2, after 8 weeks, they received a prompt for another survey. And during those 8 weeks in the interim, they were emailed the image to which they had been randomly assigned. That image was emailed to them every week for those 8 weeks, and they received a text message reminding them to view the email. So after 8 weeks of continuously viewing this image, they were prompted to participate in the follow-up survey, the time 2 survey. They reported PrEP motivation and PrEP-related behavior again, and the PrEP-related behavior was just over the last 8 weeks. They were then presented with all 12 advertisements sequentially. So each individual had originally only viewed one. They were then asked to view all 12 and to make judgments about each of the 12 sequentially. Participants were compensated with Amazon gift cards for each of the 2 surveys, and then they were also entered into a lottery for $500 for every week that they viewed the email advertisement. So we used third-party software that enabled us to determine whether or not they had opened up the emailed image, and that was intended to incentivize them looking at the image. Okay, so that was a little bit detailed. So here is a visual overview in case that helps. I know I'm a more visual person. So you can see the time 1 survey at baseline. You can see then over the next 8 weeks how there was an email sent and a text message reminder, and then the time 2 survey where the PrEP motivation and behavior were assessed, and then there was that second component, that within subjects experiment. I know some of you are not interested in the stats, so I will go through this quickly, but for the between group comparisons, we conducted 2-way Mankovas examining couple composition, campaign, and interaction effects of time 1 advertisement viewing related to 5 different sets of outcomes that are listed there. And then for the within subjects comparisons, we conducted a 2-way repeated measures Mankova examining couple composition, campaign, and interaction effects of time 2 advertisement viewing relative to the advertisement judgments. Okay, and the focus group methods are a little bit more straightforward. So there were 4 60 to 90 minute focus groups held in person, 3 to 5 participants per group. Participants were first asked questions related to advertising preferences more generally. Then they were shown and asked to respond to a visual grid with the same 12 advertisements. From there, we thematically analyzed transcripts and specifically did so using the framework method. Okay. So first I want to just give you a sense of who was in the sample. So each of these columns here represents, you can see the first column is the survey time 1 sample. Second column is survey time 2 sample, which is essentially a subset of the survey time 1 sample. And then the focus groups are in the last column. So participants largely fell within the 26 to 45 age range. They were primarily non-Latinx. Most did not have a bachelor's degree, had less than a bachelor's degree, which is 4 years of undergraduate education. Most were employed full-time or part-time. You can see here the breakdown by income, as well as sexual orientation and HIV status. So you can see in particular, most identified as gay or bisexual, and most believed their status to be negative. A few in the survey said that their status was unknown. And then finally, if you look at PrEP knowledge and experience prior to the study, what you can see is that most had heard of PrEP prior to the study. None had used PrEP in the survey, and that is because that was an eligibility criterion. but in the focus groups where there wasn't that restriction, about half had used PrEP. Several people initiated PrEP between time 1 and time 2 of the survey. And then at the bottom there, you can see outside exposure to study advertisement campaigns. So in other words, we asked at the end of the second survey, did you see these visual campaigns outside of this study? Okay, so for the online survey experiment, the between group effects on advertisement judgment. What we found was that there was a significant effect of targeting or couple composition on advertisement judgment, but no significant campaign effect or interaction effect. So what that means is it made a difference who was in the ads, but it didn't make a difference, which campaign the ads were from. So when we did post hoc comparisons, looking at the individual advertisements, this is what you get. So we're collapsing across campaign. And so the different bars represent the people who were in the ads, whether it was a Black MSM couple, a Black heterosexual couple, et cetera. And when you look at the letters that are on top of the bars, basically if 2 bars share a letter, they are not significantly different. If they do not share a letter, they are significantly different. So for example, if we were to look at eye-catching, the first judgment listed there across the bottom, you can see that the Black MSM couple, Black heterosexual couple, and multiple diverse couples, these advertisements were rated as more eye-catching compared with the advertisement with no couples. So I want to zoom in particular on a few comparisons. One being stigma and perceiving the ads to be stigmatizing. So advertisements featuring Black MSM exclusively were perceived as more stigmatizing than those featuring no couples. And when we kind of looked more specifically at the distribution of responses, we found that 42.1% of participants who viewed the advertisements featuring Black MSM exclusively, they rated them as very or extremely stigmatizing. Advertisements with diverse couples, and remember diverse couples includes Black MSM, they were considered to be similarly eye-catching and motivating and memorable compared with those that had only Black MSM couples, and they were rated favorably compared with those that had no couples. When we looked at effects on PrEP stigma and motivation and behavior, looking first at PrEP stigma and PrEP motivation at time 1, we didn't see any effects of couple composition, campaign, or their interaction. There were significant and marginally significant campaign effects on time 2 PrEP motivation and behavior. So with respect to PrEP motivation, when we did these post hoc comparisons, we saw greater PrEP willingness among participants who viewed the Prepare for the Possibilities and Play Sure campaign compared with the PrEP for Love campaign. With respect to PrEP behavior, when we did those post hoc analyses, there actually weren't any specific pairwise differences. Okay, and then looking at the within subjects effects on advertisement judgments. So this is again at time 2 when each individual was presented with all 12 ads in randomized order and rated each of the 12 ads. So within the individual. So what we saw is that there was a significant effect of targeting and couple composition, like with the between groups analysis. And there was also an interaction effect, but no campaign effect. So here is the breakdown of the advertisement judgments. And I should say that we used a smaller number of advertisement judgments for the within subjects analysis because we were asking people to rate 12 different ads. So there was just 7 judgments that they were making for each of the advertisements. So advertisements featuring Black MSM and diverse couples were perceived as the most stigmatizing of the 4 ads, but the means were generally low on these dimensions, and those 2 types of advertisements were rated as among the most eye-catching, positive, motivating, and appealing. As far as the interaction, it applied to a single judgment, and that's whether they found the ad to be offensive. So specifically within the PrEP for Love campaign, the ad featuring Black MSM was rated as more offensive than the advertisement with no couples. But here again, I just want to point out that the means of both were relatively low. So now I want to share some of the qualitative findings that really dovetail with the quantitative. So one of the key themes was that targeted ads can indeed be stigmatizing. So focus group participants really corroborated concerns related to the stigmatization of Black MSM. So they suggested that advertisements featuring Black MSM couples could be alienating and fuel PrEP conspiracy theories. And they favored more diverse and inclusive advertisements. So I'm going to share a few of the quotes. This participant said, "It's geared towards Black men for the most part, and that is, it comes across as bad, whether you have sex with dudes or not. It's bad. It's almost like racism. It's like you're over here and everyone else is over here. You're not, you're terrible. You guys are bad. We don't want you mixing with our people." Another participant said, even though there's like a good reason why these ads would focus on Black MSM, it also kind of paints a picture, whether that was the intention or not, that this is something that like gay men of color are kind of doomed to enter, the reality of being HIV positive. Another participant said, if it's solely for Black and African-American people, I would say it definitely hits the nail on the head. However, I feel that certain people, it can come across as insulting because it's almost like saying we are the ones who have the disease, like we're the only ones with the problem. Another participant said, I think a lot of people, when it comes to marketing, probably think the best idea might be to really market towards same gender loving Black men or same gender loving men of color, period. So that might be why you often see a lot of Black men. But conversely, that can also, build some conspiracies around the drug as far as, well, why are they always, why are they always marketing towards Black men or Black gay men? Can you trust it? Because even though, a lot of us think or know it's something that can help us, some think that it is something that's out to get us as well. Another key theme that emerged was that highly sexualized ads can discourage PrEP use. So the sexualized nature of some of the ads really didn't resonate with participants in this particular focus group sample. So they indicated that the sexualized imagery was unnecessary and potentially off-putting. They also indicated that targeted ads that are sexual in nature can be especially stigmatizing. So this participant said, I don't need to see intimacy. I don't need to see kissing, hugging, touching. I don't need to see skin. I think it's more appealing when you're watering the grass and just doing regular everyday stuff. I think it kind of moving away from touching and sex, they might get it and kind of explain that, hey, I take PrEP or I use PrEP or whatever the text is, but I don't necessarily want to see anybody kissing or hugging. Another participant said, especially on billboards and bus stops, you don't want to push sex. And so I'm trying to have a sandwich on the train, and then I see this and it's disgusting, whether it's gay sex or straight sex. It doesn't even matter. It's just, I don't feel like I want to see someone straddling anybody. I don't want to see her riding him in the early morning. Another participant said, if I'm walking down and it's next to Walgreens, I'm not sure if that's really the message, because then that can put out the stigma. Yeah, that would put out the stigma that then Black gay men are suggestive and that's all they are. So just to summarize, many participants perceive the advertisements featuring Black MSM couples to be stigmatizing. The sexualized nature of the ads was perceived as potentially further stigmatizing. Advertisements featuring multiple diverse couples were rated similarly in terms of the degree to which they were eye-catching, relatable, motivational, and memorable compared with those that had Black MSM only. Participants expressed a preference for greater diversity and inclusivity in the PrEP social marketing, even though in the quant data, this wasn't always significantly different in the focus groups, this definitely came through as a preference. And the ads really had limited effects on PrEP stigma, motivation, and behavior. And looking at that was really just kind of an exploratory objective. It wasn't primary. I do want to highlight several limitations of this study, one being that it was a small convenience sample. So this was a pilot study. So that limits generalizability and increases risk of statistical error. The ads were viewed and judged outside of the normal daily context in which they would ordinarily be encountered, right? People weren't actually seeing this on a billboard. They were probably doing the survey on their phone. Ad modifications limit the ecological validity. For example, I mentioned how we made all of the ads black and white. And online data collection confers risk of fraudulent responding. And indeed, with this particular study, there were several interruptions where we were hit by a bout of fraudulent responses and had to pause or interrupt data collection to deal with it. So now I want to talk a little bit about the current projects that I'm doing with MSM Living with HIV and providers in Australia. And this is a collaborative effort with people here at the Kirby Institute, as well as at the Center for Social Research and Health. And just to kind of give you the context, what I'm going to be sharing today are insights that emerged related to messaging and social marketing, but that wasn't the specific focus of the study. So the larger study focuses on patient-provider communication related to new HIV biomedical options and insights. So things like new PrEP modalities and U equals U. It also has to do with HIV stigma, but some of these attitudes came out in the conversations, and I thought that they were thought-provoking and wanted to share them. So in terms of methods, these were 1-hour interviews conducted by phone or online with 5 Australian MSM with HIV and 10 Australian providers. So I just did these the past few months. You can see the MSM eligibility criteria. So they needed to be 18 years or older, fluent in English, living in Australia, identify as a man, be diagnosed as HIV positive, and have had anal sex in the past 12 months with a man. Thank you to NAPWA for partnering with us. They were critical in terms of recruitment. And then here are the provider eligibility criteria. So the providers needed to be 18 or older, fluent in English, currently practicing either in primary care, so like general practice, or HIV care settings, and they had to have prescribed ART as well as PrEP in the past 6 months. And ASHM partnered with us for recruitment on this, so thank you to ASHM. So here are just some background characteristics. All of the men we talked to identified as cisgender men, none identified as Aboriginal or Torres Strait Islander. It was split in terms of whether they were Australian born or overseas born, all identified as gay, all reported their HIV status to be undetectable. And here are characteristics of the healthcare provider sample. So you can see that most identified as cisgender men, none identified as Aboriginal or Torres Strait Islander. They too were split in terms of country of birth. There was a range of sexual orientations. All had either an MBBS or MD. They were mixed in terms of whether they were general practitioners or HIV specialists or sexual health specialists. And then on the right, you can see their experience in terms of patients with HIV as well as PrEP patients. Okay, so emerging insights. These emerging ideas and corresponding quotes, that's my disclaimer at the top, they're based on initial review of the data. Systematic analysis is pending. Feedback is welcome. I just want to mention that this is based on this initial review of the data, but I have not yet spoken to my Australian colleagues who are collaborating on the project about them. And I'm aware of the fact that I'm an American presenting on Australians to Australians. So again, without having talked to my colleagues about it, I just want to say, like, take it with a grain of salt is what I'm saying. So both patients and providers perceived knowledge about HIV, PrEP, and U equals U to be relatively common among the MSM community, but lacking in the general Australian population. The absence of general population knowledge was linked to the lack of media representation. So the quotes that I'll be sharing, yellow, is from the MSM participants. blue is from the provider participants. The AIDS biomedical has come in, and so you don't see it in the papers anymore. You don't see it really in the movies anymore. You don't know, whereas the poor old HIV AIDS character dies dramatically, that's all sort of been removed. It's definitely not in mainstream media. The provider said, I think the people not living with HIV probably aren't as aware because it's not something they generally interact with. They don't really see it day to day. So they probably don't realize, that HIV treatments have changed remarkably in the last 20 years to the point that, people have normal life expectancies now. So because it's kind of disappeared from, the general images on the TV, et cetera. There was a perceived need for messaging to reach the general public. So to kind of go beyond just targeted messaging to the MSM community to reach the general community. So this provider said, we're targeting that U=U message to people who are at risk and know about it anyway. What we need is that message to get out to the hetero community who don't know about it. This message needs to go out into schools, needs to go into university, it needs to go into workplaces, it needs to go out, put it on a TV advert, put it on a billboard that you see when you're driving down the motorway. You've got to put these messages in other places so that we're actually getting to the people we want. Otherwise, you're just patting yourself on the back every single time you go to an MSM event and talk about U=U. This MSM participant said, it's like there's a very big gap between undetectable and to the general public. And I feel undetectable, it should be something brought up more constantly these days. I feel like HIV, it can happen to everyone. Everyone should know about undetectable equals untransmittable. And then finally, knowledge of HIV scientific advances was connected to stigma reduction. So this provider said, my experience of talking to somebody about HIV who's not in a traditional risk group and hadn't had those public health messages towards them. So with that serious lack of information, there's still great stigma towards people who are living with HIV. There's been so much directed education around HIV and PrEP to certain populations that could be, I think, extended to a more general population. And I think that would at least help to reduce stigma. And then this participant said, this is an MSM participant, my mother, who also lives in Australia, over the years, she has got her knowledge base updated. She's up to speed. And I remember there was one time, some of her friends who are, conservative Catholic Asian migrants, they were talking very negatively towards gay people and HIV and she actually stood up for the community and said, like, what you're saying, it's just not scientific. To me, that was a conversation that is so powerful. That's almost like having allies in society and just like diminish the stigma and the myth around HIV and AIDS. In an ideal world, after the science of U=U, there shouldn't be HIV stigma existing anymore. The fact that we as positive people still face stigma means the message is not delivered in a way that can be absorbed by the broader society. Okay, so I want to take a few moments just to talk about the implications of both of these studies, and specifically with respect to this notion of targeting when it comes to HIV messaging and social marketing, targeting versus a more inclusive or broad approach. So results of our study with US Black MSM suggest a targeted approach can reinforce existing stigma experienced by the targeted group, could fuel distrust and conspiracy theories, and it could cultivate misperception that new HIV prevention options or HIV-related knowledge is only for targeted groups and not for others. A targeted approach can also discourage uptake from people who are assumed to be in the targeted group who do not identify with the targeted group. So in other words, if there is an assumption that people who take PrEP are gay men, a man who has sex with men who doesn't identify as gay may not want to take PrEP. It could discourage uptake by targeted group members who wish to maintain privacy about their group membership. So in other words, a gay man who is out about his gay status may not be out to everyone, and he might feel that this would convey or share his status more broadly than he would like. And it can also undermine public policy support given existing stigma related to targeted groups. inclusion of both target and priority group member or target or priority group members, such as Black MSM, as well as people with different sociodemographic characteristics within a single image, could align with the preference expressed by Black MSM in our study for diversity. And by still including those group members, it could simultaneously ensure representation and fulfill that goal of reaching or prioritizing resources to a group disproportionately affected by HIV. Results of our study with Australian MSM with HIV and providers suggest that it would be beneficial to broaden the audience of HIV-related social marketing, including not only the target or priority population, but also the broader community. So in other words, not just kind of diversifying with respect to the content in the messages or the images, but also in terms of where it's going and who's seeing it. And participants linked increasing HIV knowledge to reducing stigma in the general public. So conclusions. There may not be one size fits all solution when it comes to optimizing HIV-related social marketing in any given circumstance or context. I know that you might be thinking after this whole presentation that I'm like really advocating and coming down hard on the side of like, it must be inclusive, we should not target. And that's not actually where I land with it. Like, I think it's something I'm conflicted about because on the one hand, in many situations, broadening the reach and perceived relevance of imagery and messaging while still maintaining representation might avoid perpetuating stigma, it might help to reduce it. But on the other hand, borrowing the words of the Australian MSM participant who talked about an ideal world, in an ideal world, stigma would not exist and sexuality would be less taboo. And so perhaps targeted imagery and messaging, including those that are sexual in nature, maybe that's what's needed to challenge stigma and move us closer to that ideal world. So in closing, I just want to acknowledge the study participants, our recruitment partners, my colleagues here and at CSRH, my US co-Is and the collaborators. You can see my funding listed there. And also I just want to thank my team back at George Washington University. Thank you.
Thank you very much, Sarah. That was fantastic. Really interesting. I think this whole question about targeting is super fascinating in the area of PrEP, not just around social marketing, but also just things even like eligibility criteria. Yeah. There's all these discussions that are happening worldwide about should people take the approach of really trying to get the best bang for your buck by really targeting PrEP, or should it just be open to anybody who asks for it? And this is really happening in Asia, I think in particular, where they're trying to go, I think, for that more broad-based response in terms of PrEP eligibility. But one of the impacts of that is all those people who aren't necessarily very, very motivated to be on PrEP, go on PrEP. And then you have these huge drop-off rates because you're not necessarily doing really, really good targeting from the beginning. Yeah. So it's this real challenge that we have about which way we go. And then, of course, social marketing brings in all those interesting questions that you've raised.
Yeah, there's really a tension or kind of 22.
Yeah, so thanks for that. Let's go with Philip to start.
Yeah, thanks. That was really fascinating. And I guess also perplexing. And I guess I was thinking about the history of some of the debates that have happened around representation of people from different races in the development of HIV prevention social marketing campaigns in Australia. And it used to be the case that there was a long-standing criticism that they were too white and that non-white men in particularly campaigns directed at gay men were not represented. And there's been a real change over, I guess, the last, 10, 20 years in particular in that. But I guess in terms, my question, I guess, are two questions. Like, I'm interested to know whether these campaigns were focus tested and whether people in the focus testing had the same sort of reactions, because presumably they were focus tested with Black men and other men in the target group. So that it's interesting that that was not picked up. But I guess also I wonder about whether, the particular historical and current context of racism and stigma in America or parts of America may influence the way people from different races and different cultural groups perceive and respond to advertisements. I remember a long time ago in 1990, I happened to be in San Francisco and joined the San Francisco AIDS Day parade, and I was right in front of a float which was brothers loving brothers. It was black men, trying to build a community about pride in having sex with other black men. So that was a very overt sort of thing compared to, I guess, shame or wanting to be hidden. So I'm trying to reconcile all of that and wonder what you have to say about that.
Thank you for the comments and questions. So with respect to your first question about whether these campaigns originally in their development were focus group tested. I know for certain the PrEP for Love campaign, which was the most sexually explicit of the campaigns, was. In fact, there were, the group that developed the campaign, many members of that group were members of the Black sexual and gender minority community. And so I'm mindful of that, I think, when being critical of the campaign, because I think that it was developed, it was something that was very empowering. It is very empowering to a lot of people. And yes, it didn't resonate in our groups, but our groups were in Washington, D.C., and this was a community in Chicago. And so to answer your question, I think there's the risk when you develop something that's sort of sexual and racy in that way, that it may not be embraced by everyone. But it was something that was embraced and empowering among those who developed it, and presumably by many viewers as well. And then your second question was about racism in the US. I didn't quite follow if you wouldn't mind repeating it.
I guess I'm wondering about the generalizability and whether the particular context of racism in the US or in Washington may have, whether in your view, it may have affected the way that people responded to those advertisements in a way that may not happen elsewhere with a different context.
Yeah. So I think that, as you said, these aren't intended to generalize necessarily. This was a small pilot study. These groups took place in Washington, D.C. It was not a lot of people. That being said, there was another study that took place in Chicago evaluating the PrEP for Love campaign, and it did highlight that they essentially looked at the calls that came in to the PrEP call center following the campaign. And among the calls were concerns about stigma and about racism in the ad. So there were members of that community that reacted negatively. At the same time, there's also been research evaluating that campaign, seeing that, there are positive effects as well. So I think in terms of what's come out from that campaign in particular, the evaluation findings have been mixed, that racism is not unique to Washington, D.C. There is that broader culture in the US. And in fact, I think that Washington, D.C. is often thought of as a more progressive city or area of the US. So I think that if there's a concern in Washington, D.C., it's apt to be elsewhere as well. The other thing I'll mention is that there have been studies that have looked at targeted social marketing of PrEP, kind of not specific to particular campaigns, but just in general, looking at MSM and Black MSM attitudes, and these themes and concerns related to targeting have come out in that research as well. And that's been in various cities in the US.
Thanks. Carla, we'll take one from Carla and then we'll go some questions online.
One technical clarification for you had the exposure weekly over 7 weeks between time 1 and time 2 survey. I was interested in why the repeated exposure over time.
Yeah, so we were interested in looking, it was sort of exploratory, but looking at some of these effects on motivation and behavior. And so the motivation for having a longitudinal survey was to see after a span of time, after this exposure, during that span of time, would there be any impact on behavior? So that was the motivation for it being longitudinal in nature. And then we wanted to, I guess, rather than just after 8 weeks asking without that repeated exposure. We thought the repeated exposure would help to kind of like keep that image fresh as opposed to like seeing it online briefly one time. We were also thinking that when it comes to visual advertisements, you know, sometimes people would encounter it in daily life on a regular basis as well. So maybe it's at, you know, a poster at the bus stop that you see regularly when you go to that bus stop. So I think that that was the thinking behind it.
So that's going to be the question. One is your comment about the ecological validity of the study structure because people aren't seeing them as they would in everyday life. And I was reflecting on the comment the person made about did want to see sexualized imagery while eating a sandwich on the train.
Yeah.
So the setting in which the imagery or message comes about, it's very hard to manipulate in study circumstances.
Yeah.
But it could be something that the bland text-based thing appears on the subway boarding and the more sexualized imagery appears on it or whatever else, according to the way in which people are searching for partners or is that, do you know if research has been able to do that kind of world exposure to messages selected for different settings?
I'm unaware of any research offhand, but to your point, that is something that came up in the groups. And so I don't know, to put in a plug for my article that will hopefully be published soon. We do go into more detail about that in the article, and just that was something that came up among the men in our study, is that there may be a place for sexualized ads, but that would be like in apps or like in a bathhouse or in like sexual, basically like sexual ads belong in sexual spaces. And, you know, in just sort of the general public, they wanted to see the ads toned down.
Yeah, and that's, I think, quite similar to what we do here in terms of our health promotion. I think it's, you know, the really sexualized stuff is on apps and in sex on premises venues. But it was interesting, some of those people were even saying, I don't want to see hugging and kissing, which I guess from our point of view here, we wouldn't necessarily have a problem with seeing that on a bus stop.
Right, right.
Anyway, I might just jump to, sorry, I know you've got a question, Curtis. I might just jump to a couple of these. So Dean was just wondering about whether the same attitudes might be held towards HIV treatment advertisements as to PrEP. And he just makes the point that we don't have direct-to-consumer marketing here. Yeah. So whether that might make a difference too.
Yeah, so I guess I can't speak to that based on the data that I collected in that study. I mean, I guess I could speculate that that could be relevant. I know there's also been research looking at like targeted advertisements towards Black and Latinx MSM in New York that was around HIV testing. And there was a similar issue around like not liking the targeting. So I don't know. I don't think it's specific to PrEP necessarily. I can't really say given the data we have. As far as direct to consumer advertising, sorry, what was the thinking about?
Oh, he just mentioned it. I don't know if that was the most important comment.
Yeah, I guess I don't have any specific comments on that.
No worries. So the next one from Bridget was there something about the research context when you were running, I guess, the focus groups and also the quantitative part that kind of highlighted or introduced the concept of stigma?
Yeah, so we did, okay, so in the groups themselves, so the groups took place in person, and initially we kind of left it broad and were asked about preferences, but ultimately in questions, we did ask about stigma specifically. So it is, I think what she's probably alluding to is maybe the prompting could have elicited some of those perspectives. But we didn't just ask about, you know, about the ads being stigmatizing, we were also asking, are they empowering? And we were asking about positive aspects as well. So those attitudes could have emerged as well.
Yeah, great. Curtis, do you want to go next?
I just have a clarifying question and kind of being off from that. So I think, you know, there's a lot of issues that is just, you know, Black MSM, lagging kind of uptake in statistics. I think you also mentioned that after the survey group was exposed to the ad they didn't report a kind of an increased motivation for adopting. Is that correct?
Yeah, that's correct. So we actually measured motivation at time 1 and at time 2. So at time 1, there wasn't an association. At time 2, there was an association related to campaign, but not couple composition or not targeting.
So I guess with the lack of the effect of the type of couple in the campaign, in the type of targeting of the ad, I'm just kind of wondering whether or not, do the targeting campaigns work in the actual getting the person to start taking up PrEP? That's kind of my big picture question. But specifically for these ads, there's lots of mentions of stigmatizing what this meant for the Black MSM community, but not necessarily about whether or not this ad actually made me think about, oh, I might actually take up PrEP, and perhaps barriers to why I would or wouldn't take it. This doesn't really, this is kind of putting the onus a lot on the individual to be the one to initiate the PrEP, but kind of not thinking about, oh, I also have to think about the cost of PrEP, or it's all well and good that I see myself on this PrEP ad, but I don't have insurance, like my company doesn't have it. So, did that come up at all in the focus groups?
So the part about whether seeing those images could be potentially encouraging or discouraging, right? Like that aspect came up, right? Like people talked about how some of the images could be off-putting or discouraging. We didn't really delve into other barriers in this study. So you're mentioning cost, another thing, there are plenty of structural barriers that may exist, but we didn't ask about that specifically in the groups.
Great, thanks. Got a couple more online. So we've got some complicated ones, so I might have to break these down a little bit. So Tim from Acon is asking a couple of, I guess, points of clarification about how the studies were run to start. So was the advertising developed by non-white or I guess Black MSM campaign directors? And then also who ran the qualitative focus groups? So whether was this by a person of color themselves or was it by a white person?
Yeah, good question. So I know definitely with the PrEP for Love campaigns that there were Black sexual and gender minorities who were integrally involved in the development. I don't think it was, I know it wasn't exclusively members of that group, but they were, definitely represented. I don't know about the other 2 campaigns, what the composition of the campaign development team looked like. And then as far as who ran the focus groups, it was 2 of my graduate students. So one is a Bosnian queer identified person, and one is an Indian queer identified woman.
Thanks. Tim's made some other points here. I might just skim them. I'm not sure if that's questions as much as comments, but so I think he's just making the point that we can't necessarily transcribe those results from US Black MSM directly across to our situation here because of the positionality of Black men in the US. I guess the point he's making here is one of the primary groups that we care about here would be Asian men who are sex with men. I think it's quite a different context and we can't just necessarily lift those results, but there might still be some interesting points. And he makes the point here that some of that feedback did resonate with him with the focus groups they've run with Middle Eastern men, for example, which is interesting. Okay. Some comments about breaking down stereotypes, but I might jump to a couple of other people. So Heather McCormack, as I all said, she did some recent work with Aboriginal young people and found a strong aversion to social marketing that they perceived as targeted towards their demographic, but a strong preference for social marketing that they perceived as tailored towards. So is this distinction evident in your research at all?
Did she probably did not elaborate in the comment. I'm wondering like what the distinction was as they defined it, right? Like what the distinction between targeting and tailoring was. Are we able to have her like zoom in or
Heather, if you want to jump in and add more, please do, and we'll read out your comment. But otherwise, I'm not sure if she's still there.
Yeah, because I mean, in my groups, we didn't specifically talk about the distinction between the 2, and I'm just curious, maybe if she can break down exactly what the distinction was in her work.
Okay, she's going to talk, but we'll go to the next one.
Okay.
So Benjamin Hegarty said he was also interested in the definition of stigma in the US study, which is quite a complex concept. For example, one or two of the participant comments explicitly raised racism. So he was wondering how racism and stigma overlap, are different, or offer different analytic insights.
Okay. So with respect to the focus groups, I don't believe we explicitly defined stigma for them. We use the language. If we did, I don't think we did. So we didn't, racism came up. That was something that they said in their responses, but we didn't ask about different types of stigma. In the surveys, I know I didn't go into depth about the specific measures, but the stigma outcome that we looked at was the PrEP anticipated stigma scale. So that has two subscales. One is focused on perceived PrEP stereotypes, and one is about perceived disapproval by others if one were to initiate PrEP. And so we looked at those scores. So I guess that's the best I can do in terms of defining stigma in the study.
Yeah. So anyone from the audience want to say anything more while we're just waiting for Heather to potentially type? We've got 5 more minutes. Oh, there is one here. She's typed. Excellent. Okay. So basically they felt that the materials that made them feel singled out as being at greater risk or more likely to have STIs were not appropriate. But materials that felt like they'd been designed with their needs and values in mind were not only good, but vital. So she said she found the distinction interesting because it's a really delicate balance when developing campaigns.
Yeah, I find that very interesting. I guess it's not a distinction that came up in our particular groups.
Really fascinating stuff.
Yeah, yeah.
All right, we might leave it there. We've got no more questions coming in from online. It doesn't seem like anyone here has any more questions. So thanks everyone for your attendance. Thank you so much, Sarah, for a really, really fascinating presentation, and everyone have a good day.